Malaria. In the time it takes to say that word, 10 people, most of them young children or pregnant women, will contract malaria. Although malaria has been virtually eliminated in developed countries, there are nearly 300 million acute cases of malaria throughout the world each year, causing more than 1 million deaths. Africa is particularly affected. Malaria is a debilitating and life-threatening disease that strikes millions of people. Pregnant women are 4 times as likely as other adults to contract malaria and twice as likely to die from it. In Africa, at least 24 million pregnancies are threatened by malaria each year.
Malaria, I think sometimes people forget how big of a problem it is because it's so endemic. It's just become the way people live, is to have malaria. You talk to people and they say, oh, I was out of work this last couple days because I had malaria. And they just sort of seem to take it in stride. But malaria is the #1 cause of infant mortality and child mortality in Africa and in Malawi.
Malaria is endemic throughout sub-Saharan Africa and many other places in the world as well. And this chronic infection that so many people suffer from, leads to anemia and decreased, productivity, feelings of fatigue. It is a really huge burden for people who live in endemic areas who are constantly having to deal with this.
The complications of malaria to pregnant women are 1, abortions, 2, they deliver premature babies, 3, they deliver at term, but the weight of the baby is very low. And sometimes they get anemia, and sometimes they die from it.
Malaria causes loss of income. 30% of the national budget is spent on malaria, patients in the hospital with malaria. It's estimated 20% of household income is spent in seeking malaria treatment. And in a country where annual income is $150 a year, 20% of that income is really significant for families.
The International Health Ministry's Office of the Presbyterian Church USA has supported community-based malaria prevention networkers projects in Africa since 1999. Networkers projects in Malawi have extended their activities to become Networkers Safe Motherhood projects, targeting pregnant women. The Presbyterian Church USA, its partner in Africa, the Central Church of Africa Presbyterian, or CCAP, and the Reformed Church in America work together in the Safe Motherhood projects. At a government health center in Chipoka, Malawi, over 200 women with their babies come to the clinic for health screening. In addition to receiving health services, the women are informed about the dangers of malaria. Networkers Safe Motherhood projects provide malaria prevention education, insecticide-treated bed nets, and malaria prevention medication to expectant mothers in rural areas of northern and central Malawi. As few as 5% of women in poor and rural areas have access to mosquito nets and preventative treatment. The Safe Motherhood projects work closely with the Malawi Ministry of Health to implement programs that service these communities.
Malaria has been causing trouble in my family because of mosquitoes. When kids get sick, they have pain and they fail to go to school because of this malaria. Members of my family are not happy because of malaria.
Working in partnership with the CCAP in central Malawi, the Reformed Church in America organizes women in volunteer committees led by Community Development Facilitators, or CDFs. The CDFs and their committees present malaria education programs in their communities and sell mosquito nets at locally affordable prices.
It's important to develop their community's lives. If they have healthy body, they can work in their garden, going this way and this way without suffering. If the family is suffering from malaria, the family cannot develop. If they have chicken, Then we said, you get this net and you give me a chicken. I will go to the market and sell it. Yes. I tell them that I am doing this to keep your life safe, to keep your family safe. We don't want you to have malaria every now and again.
Here in Malawi, we are all working together, the church and the government. In fact, as we trained our women in these congregations, we also went to the hospitals to tell them about our program, and they have accepted us. And our women